My name's Evelina McDowell. I'm a nurse and a certified diabetes educator, and I've been asked to come talk to you about diabetes. First off, I just wanted to offer you my congratulations on your pregnancy and on being a mom. And we're going to use the story of Anna to talk about what is diabetes, what are the different types, how could it affect your pregnancy, what you can do to have a healthy baby. But first off, I'm going to ask a question. If you have risk factors for diabetes, should you be checked before you get pregnant? What do you think? True? False? Or I don't know what the risk factors are. I'll give you about 15 seconds just to think about it. Okay, so it's true. If you have risk factors such as a family member, a close family member, like your mom, your dad, a brother or sister, you should be checked. If you've been told that you have high blood pressure or high cholesterol levels, if, for instance, you happen to be overweight or you're someone that doesn't do a lot of physical activity, you basically don't exercise regularly, that should also be checked. If you had diabetes in a previous pregnancy, the gestational diabetes, that's another indicator. And if you're a member of certain groups such as African American, Hispanic, Asian, Native American, or a member of the Pacific Islander, then according to the American Diabetes Association, you should be checked before you become pregnant. Learning what your risk factors are is a big step to having a healthy pregnancy. So let's go on and talk about Anna. Anna is a young woman who, she and her partner decided it's time to start a family. She goes to her next birth control appointment, but tells her provider that they're thinking about starting a family and not renewing her birth control. Her doctor congratulates her on her decision and decides to review a healthy planning pregnancy list. And they talk about no smoking, no alcohol, no drugs. And she also takes Anna's blood pressure. She notes that Anna has told her in the past that her sister has diabetes and has had it for several years. She also asked Anna if she has any concerns about her current weight, if she'd like a referral to talk to a dietitian to come up with a meal plan. Anna's really comfortable with that and she agrees to that. So the doctor makes a referral for a dietitian and she also writes some lab orders for blood sugar testing. Anna agrees to continue to use her birth control until she gets her results. Understanding diabetes really is about learning how food and insulin work in our bodies. When we eat food, most of it changes into a sugar called glucose. That sugar travels through our blood and gets put into the body cells, and the body uses it for energy. It's only able to do that with the help of insulin. Insulin is a key that helps you unlock the doors to the cells where the sugar can leave the bloodstream and enter the cells and get used for energy. When people have diabetes, for some reason that insulin does not work right, there's not enough, and the sugar builds up in the blood. So you're going to see in the following chart, there's a picture of how blood sugars work in people that don't have diabetes. They go up and down all day long. So they may eat their breakfast, blood sugar goes up, insulin comes out and does its job, blood sugar goes down. And you'll notice in the chart for all the meals and the snacks, it's going up and down. When people have diabetes, it doesn't go down as readily because of the fault of the insulin. So there's an organ called the pancreas, and it's near our stomach. And the pancreas produces various hormones. One of those hormones is insulin. Insulin is simply a hormone that helps you use that sugar that comes from your foods. So as I mentioned before, if you have enough insulin and it's working right, the sugar gets moved out of the bloodstream, blood levels go down, and your body is able to use that sugar for energy. If you don't have enough insulin or any insulin, your blood sugars go up. People might feel the signs of high blood sugar. They may feel sluggish, they may feel tired, they may feel thirsty. If you're a woman who has diabetes or prediabetes or gestational diabetes, those high blood sugars can rise very quickly and very high and cause damage to your growing baby. So how does diabetes develop? It develops in one of two ways. Either you don't make enough or any insulin, or your body doesn't work well with the insulin that you have. Either one of these things will cause your blood sugars to rise really high. So the doctor may order certain lab tests to see where your blood sugar levels are. If you have risk factors or if you have diabetes, they will order some of these tests. The first one is something called an A1C test. And what this is a 3-month blood sugar average of all your highs and lows, all the numbers rolled into one number. If the result comes back at less than 5.7%, that's normal. That's a blood sugar that it does not indicate any kind of issue. If the result comes back between 5.7 and 6.4%, that's an indication that the blood sugars are higher, and that's prediabetes. If the number comes back at 6.5 or higher, that is indeed diabetes. People who have diabetes tend to try to live within the safe zone between 6 to 7%, because higher than that can cause issues. Another test that will probably be ordered is a fasting blood sugar test. That's when they check your blood sugars to see what they are in the morning after you've not eaten all night for 8 hours or more. A normal result would come back with a number of 99 or below. If the number comes back between 100 to up to 125, that is prediabetes. And if your result falls at between 126 and above, that probably indicates that you have diabetes. Another test that the doctor might order would be a random blood sugar. That's when they check your blood sugar without any indication of being fasting. So you may have eaten or not eaten. And what they're looking for to see there is how high is your blood sugar after a certain amount of time has passed since you've last eaten. So 2 hours after someone has eaten, if they don't have diabetes, that result should be less than 140. If it's 140 or higher, that could indicate that that person has diabetes. Another test that they do, not as frequently, but they can, is called a glucose tolerance test. And with this one, they give you something sweet to drink, and then they draw your blood a couple of hours afterwards. They want to see basically how high your sugar goes in response to the sweet fluid that you drink. It's very similar to the test that's given to pregnant women in the latter part of the pregnancy when they're checking for gestational diabetes. So these are the tests that might be done if you have risk factors or you actually have diabetes. For other women that don't have this, they'll do a check for blood sugars later in the pregnancy, somewhere around 25, 26 weeks, they'll be checking for this. So there's a chart that you'll see that goes over these numbers again. It's called the Road to Diabetes. It gives you the diabetes numbers, the pre-diabetes numbers, and the normal numbers for your reference. Okay? So Anna goes back to the clinic, and her provider gives her test results. And she finds out that her A1C is 6.0% and that her blood sugar was 114 fasting. So what does that say? She probably has prediabetes. And that is indeed what her doctor tells her, that she's got prediabetes, and that that's a risk factor that it could eventually turn into type 2. And if she does get pregnant, there's a good chance that she'll develop the gestational or the diabetes of pregnancy, and they'll have to watch her closely. Anna doesn't have any of those symptoms of high sugar, and she's concerned. She has also asked her provider, what are the different types of diabetes then? So the doctor talks to her about what is type 2. That is the most common kind of diabetes. It affects 9 out of 10 people who have diabetes. With type 2, people have insulin that doesn't work the way it's supposed to, and so the sugars stay high. And they also may have little or not enough insulin to match their blood sugars and bring them down. With this, if the numbers stay up high over time, it can cause serious health problems, such as heart attacks, strokes, kidney failure, eye problems. But there are things that you can do to help control the numbers. She also mentions that there's also another type called type 1. This is the type that generally affects children, young adults, but it can happen at any age of life. For reasons we don't really fully understand, the pancreas just ups and stops making insulin. These folks get really sick and they have to inject insulin all the time to stay healthy. Again, this one is very rare. And then, as we mentioned before, the other kind of diabetes is the pre-diabetes. And this is where the numbers come up higher than normal, but not yet at a diabetes range. People who have pre-diabetes may never develop type 2, but they can. And Anna learns that one of the ways to help cut back on that risk is to continue to try to work on losing weight and to be active. Even small amounts of weight loss, such as losing 5 to 10% of your body weight, can help make a difference. So what does that mean? So for example, say you have someone who weighs 200 pounds. If they lost 10 pounds, that's a loss of 5% of their body weight. Small steps can bring about big changes. The additional type that the doctor mentioned is the gestational diabetes, or the diabetes of pregnancy. What happens in this case is that as the pregnancy continues towards the latter part of your pregnancy, the baby is growing and your body is putting out a lot of blood sugar to help maintain the growth needs of that developing baby. And so your body then also has to put out a lot of insulin to help you be able to use that sugar for you and your baby. With gestational diabetes, what ends up happening for some women is that insulin just doesn't work right and the sugar levels stay high, and when we check we can see that. And as a result, that can cause problems for the mom and the baby. And those women may need some help to have a successful outcome to their pregnancy, and that's gestational. It's because of the effect of the pregnancy hormones on the mother and the baby. Anna also learns about what are the risks of maintaining that high blood sugar. What would happen if the blood sugar is not controlled? So what does happen? We know that women who have diabetes, or there are sometimes some women that don't even know they have it, and they get pregnant and they have these high blood sugar levels. Those women have an increased risk of having a baby born with a birth defect, especially if the sugar levels are high during those first few months when the baby is forming. The other thing that could happen with high blood sugar levels is that the moms could have a stillbirth, or they could have a spontaneous abortion. Another thing that can occur with mothers who have high blood sugar levels is that the baby can get really large from all that sugar that's being pumped around in the bloodstream, and they can have babies that are 9 pounds or larger. And I don't know about you, but that could make it very hard to have a delivery when the time comes, and it causes problems for mom and baby. Finally, a couple more things can happen with those large babies. Because they've had so much blood sugar in them, they have a lot of insulin levels in them too. So when that baby is finally born and making their own sugar and their own insulin levels, they can be really at risk for low blood sugars because of all that insulin circulating in their blood. And they have to be watched very carefully after birth in the hospital to make sure they're not having low blood sugars. And finally, women who have gestational diabetes, that diabetes of pregnancy, those children, when they get older, have a bigger risk of having obesity and type 2 diabetes themselves. So these are all reasons why you may want to think about planning your pregnancy and having healthy babies. So, question number 2. You ready? Seeing my doctor and talking about my health and potential issues and working on them ahead of time can help increase the chances of having a healthy pregnancy or baby. True or false? That should be an easy one. It's true. If you have diabetes or some other health issues, it could be being overweight, it could be having high blood pressure. Talking about it before you become pregnant can increase the outcome of having a healthy baby. So Anna keeps her appointment with the dietitian, and together they come up with a meal plan for Anna. Anna learns about healthy eating. She learns about different kinds of carbohydrates and proteins, healthy fats. She learns about how to cook with healthier options, baking instead of frying. She learns about the importance of cutting down on sugar and processed foods, cutting back on fast foods. She learns the importance about eating regular meal times, not skipping meals, and all these things to work together to help bring about that healthy baby. Also, with her doctor's okay, she and the dietitian come up with a walking plan for Anna to help her become more active and burn off some of those calories to lose weight. Okay, so Anna goes back to see her provider, and the doctor is pleased to let her know that her numbers are down, but she's going to still need to be monitored. The doctor goes over what are the results for blood sugar goals when someone has gestational diabetes. And in Anna's case, that still is not happening yet, but it could. So he lets her know that for women who have either diabetes or the gestational diabetes, when they check their blood sugars on an empty stomach, the number should be at 95 or less. If they've eaten 2 hours after they eat, it should be like 100 or 30 and less. And the A1C should be around 6.0%. At the 24th, 25th weeks, Anna gets that gestational diabetes test. She drinks the liquid and does the blood work. And when she goes back to see the doctor, he lets her know that, you know what, at this point in time, yes, you really do have the gestational diabetes. Anna feels a bit sad about that because she's been working really hard, but it just spurs her to keep on going and doing her best to keep her sugars in control. And as it turns out for Anna, she's able to control her blood sugars by watching what she eats and by continuing her activity level, her walking, and also by keeping a food log, keeping track of what she eats, how much she eats, because that can give her a good idea of the effects of certain foods on her blood sugar levels. After following the recommendations of her doctor and dietitian, Anna gives birth to a healthy baby without any problems, and both she and her partner are really thrilled and overjoyed. And because Anna's just an example, not an actual patient, I'm going to leave it up to you whether she had a boy or a girl. What I want you to know is that even though these issues happen, diabetes, high blood sugars, it is possible to have healthy babies given that you do a couple of treatments, do some things. So one of the things that comes next after the baby's born, what happens then? For women that have gestational diabetes, one of the things that you really want to try to do is to breastfeed, and breastfeed as long as possible, because that helps prevent diabetes, it helps lower blood sugars. The other thing that you want to do is you want to make sure that you keep your 6-week postpartum checkup. You want to get that lab work done to make sure that the diabetes has gone away. Because if it hasn't, then there are steps to take to keep your blood sugars in control after that. The other thing you want to think about is, you know, what am I going to use for birth control? You want to have that set in your mind before you get home. Finally, the other thing to keep in mind is that for women who had gestational diabetes, that diabetes of pregnancy, there's a good chance that within 5 to 10 years, it could go ahead and convert into the full-blown type 2. So as I said, each year it's going to be really important that you follow up with a clinic or your doctor and get checked to make sure that it's not come back. So there are 5 things to do to have a healthy pregnancy and baby. 5 things to think about. First off, you want to plan and get your body ready for that pregnancy. You want to talk to your doctor about what are the risk factors for your health. You want to think about, you know, how my weight, my blood pressure might impact this pregnancy. If I have diabetes, you want to think about where my blood sugar's down, how can I get them into better control. You may want to think about and talk with the doctor about, you know, when do I start taking prenatal vitamins, taking something with folic acid. That's the first step. The second step is to think about eating more healthy and becoming active. If, like a lot of us, we're couch potatoes, well, it's time to start thinking about doing exercise snacks and starting to move. It's time to think about how can I, you know, start eating a little bit healthier and getting my body ready and in shape to have this pregnancy. And then continue that healthy eating throughout the pregnancy so that my baby grows at a good rate and that I don't gain too much weight. The other thing is to think about, as Anna did, if I'm a little bit overweight, then maybe I can try to lose a few pounds before I get pregnant. The third thing is medicines. If you are on medicines for whatever reason, then that's one thing to bring up with the doctor before you get pregnant. Is this something that I can still take with my baby, or will it have to be changed for something else? If it's a woman who already has diabetes and she's on oral medicines to lower her blood sugar, need to be aware that many times there's been no studies to show what effect those oral medications can have on a growing baby. And so many times, depending on your blood sugar levels, the doctor may need to put you on insulin during the pregnancy and then switch you out afterwards. So you may have to learn how to give yourself injections and learn about the symptoms of low blood sugars and how to take care of them. And if one hasn't been checking your sugars regularly, we need some help in learning how to do that and learning about the numbers. The fourth thing is, again, monitoring your blood sugars and, you know, knowing what is the goal for myself. You know, when does the doctor want me to check? When's the best time? What do I do if I'm not getting the numbers that we agreed upon? Who do I call? And the other thing also is, if I think that I'm having questions about the sugars or about the numbers, and then, calling the provider, calling your doctor's office, calling the nurse, having a contact number of someone that you can call to get the information readily. Don't wait, get the answers. And then the last thing is, again, knowing the signs of low blood sugar, because that can happen when people take insulin, and knowing how to try to prevent that and to treat it correctly so that you're not going from really low to really high up to the sky. No ping-ponging of numbers. In this class, we have talked about, what is diabetes, what effects high blood sugar levels can have on having a healthy pregnancy and healthy outcome to your pregnancy. We've talked about the different numbers, the different lab works that might be needed, and about the need to plan that pregnancy and to make sure that your body's ready for it. And I know that surprises happen. Some of us, we find out we're pregnant and boom. So if that happens, don't feel bad. Then what you'd want to do is to talk with your doctor, your nurse, and try to get your blood sugars as quickly and as safely as you can in control. And to know that yes, it is possible to have a healthy baby as long as you try to get treatment early and quickly and take care of yourself.